Sauk County Health. Working for you, working for me, working for all of us.
Prenatal Care Coordination is a Medicaid and Badger Care Plus benefit for pregnant women. PNCC provides you access to a public health nurse throughout your pregnancy and up to 2 months postpartum. The public health nurse will come and meet you, or you can come into the office and meet her for visits monthly, and they cover support during pregnancy, finding health care, making sure you're getting the health care that you need. It covers nutritional services, visits with the WIC nutritionist for healthy eating habits. It also will cover childbirth classes if you're interested in that. The goal of the program is for healthy birth outcomes, so getting mom into early prenatal care, tobacco cessation, not using alcohol during your pregnancy, safe sleep education, involving the father of your baby in the visits, if that's what your wishes are. All of those things help lead to healthy birth outcomes. Anybody enrolled in Medicaid or Badger Care Plus is eligible for PNCC in Sauk County. We also will see any pregnant teens, regardless of their Badger Care or Medicaid status. Call our office at 608-355-3290 and ask to speak with one of the PNCC nurses. If they're enrolled in WIC, they can talk to the nutritionist about a referral during their visit with them. They can ask their provider. It's really easy that if they contact us, we're more than willing to give them the information they need and come out and set up a visit for enrollment. Everybody wants to have a healthy baby, and it's really important for us as public health nurses to be there for the residents of Sauk County and support that goal in having a healthy baby.
Here in Sauk County, there are a lot of women and children at risk. In 2013, there was about 749 births. About 50% of those were to women who have Badger Care. So that's one of the qualifications for our program. Of those 749 births, almost 40% were to first-time moms only, which is another qualification for the program. There's a lot of other risk factors that go into outcomes, pregnancy outcomes, and the child's health and development, including if mom has no high school education. I think there's about 9% of those births that had some or no high school education. We had about 8% of the births in 2013 were low birth weight babies, so less than 5.5 pounds. All those things, our pregnancy outcomes we're looking to change. So we know that there's women at risk out there and women at risk here in our community. So we want to get women into the program during their pregnancy, so they need to be enrolled by 28 weeks, 6 days gestation. We want them to be able to qualify for Badger Care or WIC, and they also have to live in Sauk County. So we have a couple goals. We want to improve pregnancy outcomes for both that mom and that baby. We want to improve childhood health and development, and we would like to improve the parents' economic self-sufficiency. And in doing all these things, for every dollar you invest in this program, we can save up to $5 in return long-term over the course of this child's first 15 years of life. We visit with them every week or every other week. So for the first 4 weeks that we visit with them, we visit every week, then every other week until the baby's born, then every week after the baby's born for 6 weeks, and then every other week till the baby turns 2. And when the baby's born, we go in for that first 6 weeks to make sure that weight gain is good. We do weights and measurements on that baby right away. And we also do screenings with the baby through those first 2 years to make sure all their developmental milestones are being met. Myself as a nurse home visitor and the mother-to-be, or if the mother's already had the baby, also the baby would be included in the visits, and anyone else that she would like to be present, we do encourage her to have her support person there with her in the visits, whether this is her mom, her friend, the father of the baby. We do really encourage the father of the baby to be present at visits. We have specific documents that are geared for fathers. With this program, they have seen a 46% increase in the father's presence in the household 15 years later. So we're out of the house for 13 years and they've still seen that increased presence in the household, which is pretty exciting. So in the home visits, I want to talk about what the mom wants to talk about. I know that there's a lot of information coming at her in the outside world, in healthcare, in the news, on Facebook, all that kind of stuff, but I want to gear it towards what does she want to know more about. So I give her a packet of information. She does not have to choose from that packet, but it does have a lot of topics in it, and the basic topics vary from her health, so changes with her body, it ranges to environmental health, what's going on in the home, how can I make this home safe for my baby. It can be what it's like to what's going on with her child. So what's the baby look like when it's born? What's it going to look like when it turns 1? What kind of things do I need to be looking for? If something's wrong, when do I need to call the doctor? And we can also talk about life skills. So she can choose to talk about budgeting or communication skills, things like that. Really, there's no topic that's off limits for us to talk about. If she wants to talk about it, I'm more than happy to do that with her. It can take roughly from 1 to 2 hours each time. It really just depends on what's going on with that mom. And I think that's a really big part of this program is it's tailored for her. So I adjust what I need to do based on what her needs are. So there's the program is never the same for every mom. It's always different. I think that's why it really works, is that it's varied and it's geared for that specific mom and what her needs are, because I meet her where she's at. What does she need right now? That's what I want to do. Short-term outcomes include increased total language skills, increased math and reading skills. There's also an increase in the number of months between births for that mom. We want to make sure that she's financially and emotionally ready for that next baby. Long-term outcomes, and they do research 15 years out. So when that child turns 15 and we've been out of the home for 13 years, they see decreased percentages of child abuse and neglect, 82% increase in that mom's months that she's been employed. So we want to make sure that we have a lot of good outcomes. Like I said before, there's that 46% increase in the father's presence in the household. All those things kind of go together, and the child itself has decreased risk of having arrest rates and conviction rates at age 15. So that's how, when I said before that for every dollar you spend, you can possibly save up to $5 in return, that's how this happens. Around pregnancy visit 5, I have a handout that I give to the mom and the father of the baby if he's present at the visits. And I just have her, not necessarily fill in the blank, but just circle some things that she would like to tell me more about. So things that she would like me to know to help her learn a little bit better, things that she'd like me to know. And I've gotten a lot of varying answers, a lot of positive feedback though about the program itself, how they like to have someone visit, how they like to have someone listen to them, how they like to have their needs met in this way. And there's a question at the end that asks, what is anything else that you'd like to tell Michelle? And I've gotten varying answers from, this program's great, keep doing what you're doing because it's working, to I'm a lot to handle, which I would already know about my client if she is a lot to handle, but it just gives them the opportunity to speak their mind and to tell me what I can do better to help them meet their needs. Because again, like I said before, that's really the point of the program, is to help them where they're at. And I want to meet her where she's at. And if I can do that better, I would love her to tell me about that.